There is one treatment that was not around when I was engaged in my battle with depression. And today I want to tell you about it, and I want to tell you about how it is impacting lives for our patients. Hey guys, Dr. D here with AlphaOmegaWellness.com. I want to chat with you a little bit about a fairly new therapy in the treatment of depression. And let me tell you, I wish that this had been around back when I was struggling years ago with depression. You see, I did the thing where I tried the pharmacy roulette, where I'd see a psychiatrist, he'd try this medicine, and I'd go on that for a little while, and it wasn't working, so he tried something different, or he added another thing, and I was one of these people, that I think most of the people that I worked with, at least, probably had no idea that I was suffering from depression. And I'll tell you, I didn't want to admit it to anybody. I remember for a long time, I didn't even want to go seek treatment for it because A, I didn't want to be labeled as having depression, and B, I knew that that would impact my ability to get life insurance. And so I was very resistant for a long time to getting treatment. But eventually I did, and I've done the thing back and forth with meds, and currently I'm not on anything. I've done some stuff to get myself healthier, but I want to talk a little bit about a novel treatment. It was really just approved 4 years ago for the treatment of depression, and that's a medication called ketamine. Now, you may have heard of ketamine. It's been around for a long time. I've used it for over 20 years in the emergency department, more for procedural sedation. So if your kid came in and had a facial laceration, we're probably going to use ketamine to kind of do what we call dissociate the child. So it's like moderate sedation. The child lays there and his or her eyes kind of jiggle back and forth while we suture the laceration. And so I've used it for decades like that. We've also started a handful of years ago using it maybe more just for pain. But ketamine for depression, let me just tell you, I've not seen anything move the needle in the mental health space like this has. I'll tell you a story. I had a patient who came to see us a little while back, and she had struggled with depression her whole life, essentially. Had some horrendous trauma in the past that she really had never really been able to grow beyond, and would spend several days in bed and just not even be able to get out of bed, just had no motivation. And so we talked about the pros and cons of ketamine treatment, and she decided that she wanted to do that. And so she got her first infusion on a Friday, and then I saw her back the following Monday, and I said, "So how are you doing?" And she got a big smile on her face, and she said, "I cleaned my whole house this weekend." And so to me, that was amazing. And as we kept doing the infusions, she just kept getting more and more benefit from it. And she's not the only person who's had that story. I mean, we see people come in with just refractory depression that's not getting better on medications, and nothing is really seeming to work, and people just feel stuck. And then ketamine does some things that we'll talk about here that really seems to cause pretty dramatic improvements. So one of the things ketamine does is it lowers a neurotransmitter in the brain called glutamate. Glutamate is this excitatory neurotransmitter. In fact, all the antidepressants work to a degree by lowering glutamate, but they do that over 3, 4, 6 weeks. Ketamine does it actually during the infusion. And so I think of glutamate as being this neurotransmitter that kind of gets us wound in knots, right? And so it plays a role in like these negative, disempowering beliefs, this dialogue that we tell ourselves. And so one of the benefits that ketamine offers is it lowers glutamate. Another thing that it does, though, is it increases a chemical called BDNF, brain-derived neurotropic factor. And BDNF, it's actually in the body. It's made by some good, healthy bacteria in the gut, but BDNF is responsible for the neuroplasticity of the brain. And neuroplasticity is a really long word to essentially explain how the brain can see and view things differently. And so what I think of this as doing is you get the glutamate down, and so you're not really in knots anymore, and then boosting BDNF allows us to maybe reframe some of the things that we've been through in our life, maybe almost to be able to look at it from the outside looking in such a way that we can then process that differently. Because as you know, we can't change what's happened to us in the past, but if we can view that in a different light, or if we can assign different values to that, now we can start to heal. And I think ketamine actually helps us do that. In fact, I always encourage everyone who's coming in for treatments with this medication to also engage in some cognitive behavioral therapy during the time window that they're doing the ketamine treatments, because I think that it boosting that BDNF kind of makes counseling maybe even more robust, because again, we're kind of seeing the brain in this pliable place where it can kind of be molded a little bit more. And so those are two of the big things that ketamine does for people. I'll tell you that I had gone to a clinic in Southern Indiana and actually had a ketamine treatment myself. And so I can speak to what that was actually like. And so when I went in, they put an IV and they actually started the drip. I kind of laid back. I had some headphones on doing more of a guided meditation. And I just let myself relax. And the infusion lasted about 50 or 60 minutes. And when I came out of that infusion, I felt good. I felt full of empathy. I didn't have any anxiety. I felt well. Now, during the infusion, I'll tell you that as I sat in that recliner, I would lay there and I would take my index fingers on the recliner and I would kind of touch the edges because I kept my eyes closed. And that kind of just let me know, okay, I'm still here. I still have my faculties about me. We've had patients in our office actually get up and go to the bathroom during their infusion. I don't recommend it, but you do have that ability. So ketamine kind of induces what I would call like a lucid dreaming state. So different from the dose that we would give in the ER to suture your kid's face, where that child is just out of it. The ketamine infusion that we do, people are still able to talk and interact and obviously able to go to the bathroom if they really need to. But listen, if you or someone you know is struggling with depression and you've tried the other therapies and they're really not getting to where you want to be, I think ketamine is a reasonable option. Clearly, every person is different, so I would never guarantee that this is the fix. But from what I've seen, it really has a dramatic impact in people's lives, and that's why I love being able to offer that. We currently just offer that at our Greenwood location, but if that's something that you're interested in talking to us about, we can set up a phone or in-person consult and chat about it. You can call the office at 317-300-4091, and we can kind of go through that with you. And if that's something that can help you, we'd be glad to have a discussion about it. In the meantime, I just want to remind you that ultimately the healing that I found that actually lasted was my relationship with Jesus. And I think that has done more than anything to improve my spiritual life, but also my physical, mental, and emotional life as well. And so if you've not explored that, let me just encourage you to do that. We're not talking about joining a religion or church. It's really about finding that love that's there, that you are a loved, eternal spiritual being, and you have a God that cares about you and what's best for you. And so, we even have pastoral counselors on staff at our office that can walk that out with you if you need. So until next week, I love you guys, and I'll talk to you then. Thanks.